So there are different types of pendulums. I recommend finding a pendulum that is right for you. Perhaps you like one that's a little more flashy, such as this one, which I usually just use for photo shoots, by the way. I usually don't use it in the office because it looks good for photographs, but I feel it's a little less than professional for a therapeutic setting. That's just my personal opinion, though. And I would more likely gravitate toward this one. This is one of my favorite pendulums because it's just very basic. There's nothing flashy about it. It looks like a plumb bob, like a plumber would use. So it's just a very basic, down to business, down to earth type pendulum. The use of a pendulum is not what a lot of people would think it is when they think about hypnotherapy. They may be inclined to think that the hypnotherapist is going to wave a pendulum and say, look into the pendulum, you're going deeper and deeper and so forth. But that's not what we use the pendulum for in hypnotherapy, especially not with advanced hypnotherapy techniques. We're using the pendulum to find out what the subconscious mind is thinking. So let's look at the dynamics of the pendulum. The pendulum, as I'm holding it here, is suspended by my hand. My hand is connected through a nervous system to my brain. My brain is therefore controlling the pendulum. Now, consciously, I can influence the pendulum. I can cause it to swing. I can cause it to rotate. I can cause it to do all sorts of things. This is what I'm doing consciously. I'm causing it to do this. I'm actually consciously thinking of it swinging around. However, I can also subconsciously influence the pendulum. And if you haven't tried this before, it's actually very fascinating. This is one of the techniques that makes believers out of non-believers very quickly, because you're able to tap into the subconscious mind. So the subconscious signals from my brain can actually control the pendulum. I've shown you how I can control it consciously. I can just do this. I can cause my hand to do this and it will move. But I can also subconsciously control it. And here's the way that works. I just think about it moving. Now, it's not magic. I'm not causing it to move with magical waves or anything like that. My hand is still moving it, but I'm consciously unaware of the minute movements of my hand which actually move the pendulum. So all I have to do is think about it moving. I'm going to think about it moving this way now, and it's going to move. I'm not going to consciously move it. I'm just going to think about it moving. Watch this. And you can try this yourself. I'm just thinking about it moving back and forth. As I'm thinking it, my subconscious mind is causing my hand to move in that direction. Okay. Now I'm going to think about it moving the other direction. So again, I'm not consciously moving it. My subconscious mind is affecting my hand through my nervous system, which is therefore affecting the pendulum and causing it to move. So just by thinking of the pendulum moving, the pendulum moves. And you can try that yourself to find out that it works. Now let's take that a step further. What if I wanted to establish a system through which I could communicate with my subconscious mind? What if I wanted to establish that this motion meant yes and this meant no, for example? Okay, so I could tell my subconscious mind that this means yes and this means no. You boil it down to two answers. You have an affirmative and a negative. You have a yes and a no. So now we need to calibrate the pendulum, and we do that by asking three questions. We don't want to assume that the pendulum is giving accurate information. We want to calibrate it, to test it, to make sure our instrument is accurate. If our instrument is accurate, then we can proceed to the next level. But right now we're calibrating. So we would ask three questions, all of which we know the answer to already, but we want to make sure. So to calibrate this, I would ask something that I know the answer to. Let's ask, am I sitting down? And if you're asking your patient, then you have them ask the question either aloud or in their minds, am I sitting down? Okay, so that is the question, am I sitting down? And it's moving in the yes direction. So the first test of the three-part process of testing in the calibration is successful. Okay. Next question. Am I breathing oxygen right now? Am I breathing oxygen? Slight hesitation, but we've got a yes. Hesitation is probably due to the fact that the majority of the atmosphere is not oxygen, only about 20% of it is, and I happen to know that, so I think that accounts for the slight hesitation there. So let's say that I am the patient and the hypnotherapist has just asked me to ask a question of the pendulum that I do not know the answer to. And let's see. I'm going to ask, we'll just say that we're in a weight loss session, and I'm going to ask the pendulum if I feel that I need to lose weight. Do I feel that I need to lose weight? Do I feel that I need to lose weight? No. Okay. So, that probably wouldn't happen in a hypnotherapy session where you're working on weight loss. The answer would probably be yes, but just to give you an example, I wanted to ask that. So I've got an answer now. I've got an answer, but during a hypnotherapy session, the hypnotherapist can ask all sorts of questions that the client may not know the answer to consciously. So they're not trying to hold back, they just don't know. For example, is your overeating caused by stress? Is your overeating caused by a particular situation? And if you get a yes on that, is your overeating caused by work? Is your overeating caused by your relationship? Is your overeating caused by fill in the blank? So as long as you have a yes or no question at each step of the way, you are going to get answers. So the pendulum can be very powerful, and I recommend using it in pre-hypnotic diagnosis, which means that all of the information that you gather by using the pendulum is going to be used before you use hypnosis on the client. So let's say, for example, someone comes into your office and during the pre-talk, you determine that they need to lose weight and that they are overeating. And the patient is not sure why they're overeating. And you are not sure why because you just met them that day. So you can use the pendulum to diagnose ahead of time why the overeating is happening. Now, I use the word diagnosis, but as a hypnotherapist, you're not actually giving a diagnosis of anything. You never diagnose as a hypnotherapist. That is something left to a licensed professional, such as a psychologist or a psychiatrist. I'm just using that word as a convenience so that you and I can have a conversation about this. So you're getting information from the subconscious mind that's going to help you understand the root cause of a situation. So I'm having them hold the pendulum at the origin where yes meets no, about an inch up, and I'm having them ask the question, either out loud or in their minds, ask the question, and I'm getting answers. So once I do that, I've got a series of answers. I know which way to proceed in the hypnotherapy session. I know what's causing the overeating, and I know a few other things related to it. And you can just continue on with the questioning until you have satisfied yourself enough so that you can begin the hypnotherapy session in a way that's going to be helpful and practical. So you may, with just basic hypnotherapeutic training, ask the patient a few questions and then begin the session. With this advanced technique, you actually have a way to get a little deeper, to get to the subconscious reasons why they're doing things. That's going to make your hypnotherapy session much more powerful.